Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. Today, I am joined by not one, but two community health navigators with Chestnut Health Systems. Karen Sours, community health navigator who has been with Chestnut Health Systems since 2022. She's the only person in McLean County currently certified to become a representative for people experiencing homelessness with the Social Security Administration to help them apply for disability. Using her own life experiences, she connects with people who have a variety of backgrounds and needs to help them find resources to meet their social determinant of health needs and help them get insurance and find healthcare providers. Angela Marinas-Mackenzie is a community health navigator too, also with Chestnut Health Systems in Bloomington, Illinois, where she works directly with individuals and families to reduce barriers to care and support whole person health. Drawing from both professional training and lived experience, she is passionate about health equity, trust building, and the critical role community health workers play in strengthening systems of care. Welcome to the both of you.
Thank you.
So let me begin straight away to ask, and I'm going to ask you, Angela, first. How would you describe the role of a community health worker to someone who's never heard of community health workers?
Yeah, so I would describe the role of a community health worker or community health navigator, kind of like, I guess, a bridge, right? So we try to connect individuals to services, whether that be, primary care or counseling services or anything else. And so we tried to help bridge the gap to any barriers that may be preventing them from accessing those services. So we try to help connect people to behavioral health, social services, and I've often framed it as we kind of walk alongside them. We kind of help, show them the steps and show them, what the proper processes are for different organizations or systems.
Excellent. Karen, anything to add to that?
Well, we do help them navigate the system that it's confusing for a lot of people. We help them figure out, how do I get the services I need? Where do I go? And what do I need to do to get there?
Karen, how do community health workers help improve outcomes in ways traditional systems sometimes can't?
Well, one of the first things we are able to do is go out into the public and meet them where they're at. We can take the resources to them. We can take our knowledge and connect them through face-to-face encounters. We can help them by taking them to their services, driving them to the doctor's office, driving them to the to the health department to sign up for insurance. Basically, we can go to them and walk them through it.
Angela, anything to add to that?
Yeah, so I think like Karen was saying, because we're able to go out into the community, I feel that we're able to kind of build a different relationship with individuals and, kind of be that listening ear or non-judgmental ear to hear, where they're at and be able to guide them in the right direction. So instead of like a doctor focusing on, a specific diagnosis or a specific concern, we try to look at the full picture of somebody and see, what are the pieces that need to be put together.
I want to take a step back for a second and ask the both of you how you came to this work. Karen?
Well, I got my degree in public health and wanted to give back. I've got some lived experience that really makes a big difference in my life, and I want to be able to help people get past some of the challenges I've faced in my life, and have found that this has been a very fulfilling role to be able to do that.
Angela?
Yeah, so I actually started off at Chestnut as a assessment clinician for the problem solving courts, which is drug court program and mental health court program. And that kind of led me to, see a lot of the issues in the community, a lot of the difficulties that a lot of individuals were facing. And when I was kind of looking for something else, I wanted to get more out into the community and kind of be a person that people could come to with different issues or concerns, and kind of be how similarly I was before, being that first person that they're able to come to and, get those next steps or understand what they need to do to access those services.
So it would be, I think, helpful to our listeners for you to paint a more vivid picture of a typical, to the extent that there is a typical day in the life in your work. And I'm assuming that while fundamentally you do the same thing, your days can look very different. I mean, Angela's Karen's day. So, Karen, if you would, and again, to the extent there is such a thing as a typical day, what does that look like?
Well, every day is different in the week. For example, on Mondays, I like to assemble an apartments available list for McLean County, because one of the needs that is currently big in the area is housing. People trying to find housing. So I update an apartments available list every Monday. And then Tuesdays and Wednesdays would be different. I might go one of those 2 days to a food pantry to help meet people there, to help them find resources to meet their needs for food, clothing, housing, etc. I sometimes meet people in the office to help them get insurance, to help them find resources for housing. Housing, like I say, is one of the biggest ones. And on Fridays, I go to the Junction, which is a community center by Home Sweet Home, where I meet with individuals who are experiencing homelessness and help them apply for disability. I help walk them through that program. Each day is different. Each day has its own challenges. And sometimes I'm in the office. Sometimes I meet with people in the office. Sometimes I meet with people at their home. Sometimes I meet with them at other organizations.
Angela, what is a typical day or even a typical week
Yeah.
look like?
So my week can definitely vary, similar to Karen's. It includes different client meetings, so meeting with individuals for different social determinants of health, such as accessing healthcare, insurance, or other resources such as housing. And we make phone calls to different individuals to, again, kind of bridge that gap and, try to connect them to services. I do attend several what we call co-locations, which are different community partners that we go to, again, help the community, bridge that gap for individuals. So throughout the week, I typically go to the Safe Harbor Salvation Army shelter. I also go to the Junction once a week. And we've started recently working with the new tiny homes with Home Sweet Home, the Bridge. I've started going there. And also working with Heartland Community College to help staff and students with accessing healthcare services.
These are very action-packed days and
Yes.
weeks. It's
Yes.
remarkable,
Yeah.
how many places you have to be in a given day in a given week. It's amazing. Karen, you already mentioned housing as, I guess, the biggest challenge that many of your clients face. What are the other big challenges? The other 2, 3 big issues?
Food insecurity is another one of the really big ones, especially with the new laws about that is limiting SNAP benefits. It's going to be becoming a lot more difficult, and so I've created a resource guide to help people find all those things, all the different food pantries in the area, all the different clinics in the area. And the biggest challenges are that, and I would say in some cases clothing, but housing and food are the two biggest.
Angela?
Yeah, so like Karen said, definitely housing and food insecurity is one of the biggest issues that we face or our clients face. And I would say another one is transportation. Luckily, Bloomington has, public transportation, which is great for a lot of people. However, I know, since I go to Salvation Army, there's shelter a couple times a week. I've come to learn that there's not, a bus that goes directly from there to our clinic. So things like those situations, a lot of times there maybe isn't a bus stop near where they need to go, or if they don't know how to navigate the bus, if they're from out of town, they may not know, the direction they need to go or where to even find the bus, what bus to take. So being able to provide transportation for people at times is a big relief off their shoulders and helps them access those, go to that doctor's appointment that maybe they've been unable to attend for months because of their not having transportation.
Yeah, access, I could see, again, having many of these conversations being a pretty universal problem in this space, but also begs the question of how do people find you or how do you find people? What are sort of the methodologies to raise your visibility in the community so you make sure that you're getting people into the system, you're providing people in need with the assistance they need? Karen?
Well, one of the things, like I said, I go to the food pantries. I go there and I talk to people while they are working with the food pantry. We also go to various community events. Next week, Connect Transit is having an employee wellness day. And I will be going out there and tabling and letting people get the information about Chestnut and about community health workers and what we do. Also, a lot of referrals from our providers that they know that some of our patients have certain needs. If they're having trouble with their insurance, the healthcare provider can refer them to us, or if they're having trouble paying their utilities, or going to get lose their housing, or they need help with Social Security applications, disability applications, we can get referrals from the providers themselves. Also, there's a lot of word of mouth. The people that I've worked with tell their friends and give my card to their friends and give Angela's card to their friends so that they can reach out to us.
Angela, could you provide our listeners with a specific, particularly, I guess, for lack of a better word, compelling example where you really made a difference in somebody's life? I mean, you've painted a really good and vivid general picture of how you work and how you engage people in the community. But I think it would be helpful to just, provide an anecdote or two about a case, an instance where you made a real impact in a life.
Definitely. So I would say one of the first, I guess, individuals that come to mind or cases is one person I worked with it started off, they saw me at the junction, and they kind of asked what I was doing, who I was, if I worked there. And I explained my job to them and where I worked. And just through that conversation, I was able to kind of, draw out of them that they were in need of an appointment for mental health services. And I was able to get them scheduled with an appointment. However, that individual was not able to attend that first appointment. And so over time, I run into them in other places, and I've been able to, just by kind of being there, being present, they recognize me. I listen to them and I provide them that, non-judgmental listening. It's shown to kind of help this person in feeling more comfortable in attending their appointments. And especially one of the things this individual said to me was um, he didn't want someone to call him crazy or to someone to think he was crazy. He had this, I'm sure it's from past experiences, this idea that he would be called crazy if he went to these appointments. And so, through reassuring him and, explaining to him, our providers and how they treat clients, I was able to, kind of get him to make an appointment again so he could actually be seen.
Yeah, wonderful. Karen, I want to ask you the same thing, but before I do, Angela, you mentioned listening, and listening generally is an acquired skill. What have you gotten better at since you've started doing this work?
I think I've gotten better at my communication in general, I think has improved greatly. I've been able to go to these different community organizations and, tell them about my work, what I do, the services that I can help connect people to. And by also, learning about their organization or these other community partners we have, we're able to kind of team up in a way to, if a case manager at Salvation Army knows of a client that needs to make an appointment or needs to get medication, they'll often come to me and be able to say, hey, I want you to speak with this person. They have these needs. So yeah, I think just being able to improve my communication with other community partners and other staff members.
Karen, so I want to ask you for an example where, your work in a very specific way made a difference or was particularly moving.
There was one individual who had spent several years in prison. He came out, he found out about me and wanted to start the process of getting disability. Through working with me, he started seeing a primary care provider. He has many chronic health issues. So he got his primary care provider. He got started with a psych provider. He was unhoused. He had no idea how he was going to get a home. He was very depressed. And in working with him, I helped direct him to a place where he could potentially get help paying for an apartment while we were applying for the disability, and helped him apply for housing. This individual was able to get into housing, found the resources to pay for his housing until the disability came through, if it would. And I'll never forget the day that he came out. This was about maybe almost a year after we turned in his application for disability. He came out of the office. I was across the parking lot and he yelled my name, "Hey, Karen." And my first thought was, okay, it's time to start the appeal process. And then, great big smile on his face, he said, "I got approved." And just the chance to make that difference, to not only help him get housing, but also to get him that disability. And his girlfriend came up to me at a time and told me that if he hadn't met me and hadn't been working with Chestnut, he just was ready to give up. He didn't think he was going to be able to continue because he had no hope.
Wow. Wow. That must have been incredibly rewarding. And let me ask you what I asked. Yeah, I could imagine. Let me ask you what I asked Angela. What have you gotten better at over the years?
I've gotten better at listening and hearing not just their words, people's words, but what's underneath their words, what's going on in their lives that's triggering the things that they need help with. And that helps direct them to the resources in a better way. And I think, like Angela said, communication. But my ability to interpret and to hear what people are saying, not just to hear what they say and then put my own spin on it, but actually hear what their need is from their perspective rather than my own.
Let me ask you both. First, Angela, what is the hardest part of your work? It's kind of a broad question. It could be, the emotional aspects of it. It could be some of the procedural aspects of it. It just could be the day-to-day challenges inherent in your work. What would you say are the hardest parts of your job?
The hardest parts of my job would, like you mentioned, probably definitely that emotional weight, mental weight, from hearing different individual stories, knowing a lot of times that even though I wish I could just flip a switch and, make that better for them, it doesn't work like that. So having to, and knowing that solutions aren't always immediate, right? So we have to often work with someone, numerous times or with different follow-up appointments to actually get to the solution or to actually have a resolution to the problem. And especially with limited resources, it is, like I said, if we could just flip a switch, it would just, make it so much easier. But a lot of times we don't have that ability. There's lack of funding, lack of staffing oftentimes. It just makes it harder to get those resources at times.
Karen, I'm going to give you an option of either answering that question or answering this one. What advice would you give to somebody entertaining the possibility of entering this field?
Wow, that's a tough one because I would suggest to somebody who's thinking about it to look at yourself and your own mental health and see, because like Angela said, sometimes it's hard. The emotional toll can be very difficult on us when with some of the stories that we hear, some of the experiences that others have had. If you haven't had any history of those same experiences, is it going to re-traumatize you? Is that something you need to worry about? Is it something that the ability to help someone through this is going to help you deal with your own past? It is a very rewarding job. It is something that can take quite an emotional toll. And just be ready if you choose to go after this as a career. Be ready to take care of your own mental health needs as well. Take time for yourself. Take some time to decompress. That would be my advice for somebody thinking about going into the field.
I want to come back to that in a second, but I want to ask, what are the common misconceptions about your work for people who are not familiar with your work, Angela?
Well, since a lot of times, people associate me with, health services or like healthcare, a lot of times when I go places, I'll get misrecognized as like a nurse or something, which we're not. We're not able to, give like medical advice or things like that, but rather we can, help advocate for them and guide them, to those people that they should talk to about those issues. And I think just also some people just not being familiar enough with community health workers and, what we do. And yeah, but I think a lot of times people think we're more of like an actual healthcare provider or like a nurse, and we're not.
Karen, how would you respond to that? The common misconceptions about your work?
Well, as Angela said, we are not in the position to be able to give health advice. We can help them navigate the system. We can help advocate for them through the system, but we can't give the medical advice. But also, we don't have a magic wand. When I get calls, I get a lot of calls from people. I've just been evicted and I have no place to go and I have no money. Can you get me a home tonight? We don't have a magic wand. We're not able to provide immediate assistance. We can help guide you to places that can help you, but there's no magic wand.
Let me ask you the last question. And, we discussed how rewarding your work is, but by the same token, how emotionally taxing it is. And in these conversations I've had doing this podcast with many of your colleagues, we talk about that duality and talk about the fact that you could win a battle, but you're not going to win the war. That's just not the nature of it. It's an ongoing, unending thing. So what keeps you motivated?
So I think for me, what keeps me motivated is those small wins. Just recently, I was able to help an individual get a new ID. They had their driver's license had expired. And then we found out they also didn't have the proper legal birth certificate record. So we had to go through the process of getting them, a birth certificate, and then navigating that, and then, setting an appointment to go to the DMV. And even though, it's something that a lot of people look at as a normal thing, right? I have to go renew my driver's license, or I have to go, renew my ID. But for this person, it was a small win, but for him, a very big win, because we were able to get a step closer to also getting him financial assistance for his home and having more success in his life. So I think definitely those small wins that we can pick out in a day that, I guess seem small to other people, but when we look at it, it's definitely a bigger win. And it's, it can help turn someone's day around just a tiny bit.
Karen, I want to ask you the same question before I do. And Angela, if you don't want to answer this is okay. Have there been times when you've had to take a breather and you've had to step away and sort of recharge, get refreshed?
Oh, definitely. Yeah. So I think there's definitely been times where we I know I've had to and whether that's, using my breaks during work or like my lunch break, or even, having to take time off sometimes to just recharge and kind of, take a step back and let myself relax and not, worry about what's going on at work.
Karen, what motivates you?
Like Angela said, those small wins, every little win keeps me pumped. Every time I get a small win, I just want to shout, hooray, hooray. And I pump my fists up in the air. And sometimes just walking into a place where people recognize me that I've worked with and just seeing them smile, or walking into the clinic and seeing someone who had a fear of going to the doctor or didn't have insurance and was afraid. Every time I see somebody that I have touched in some way, shape, or form, even if it's just getting them insured, even if it's just finding them their first doctor's appointment, every time I see someone that I've helped and they're thriving, it makes it all worth it to me.
I have to say, I really do appreciate both of you spending this time with me, and really, truly, you're both doing amazing, remarkable, meaningful work. And on behalf of everybody out there, thank you.
Yeah, thank you for having us.
Of course. Today I spoke with Karen Sours and Angela Marinas-Mackenzie, Community Health Navigators with Chestnut Health Systems. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.